Coming up on Lifeline, what we're looking at here is an almost certainly self-inflicted gunshot wound to the head. There's a bunch of powder burning right around. This job is not for everyone. There's a lot of bad stuff that happens in trauma. I mean, awful.
In trauma, there's a lot of people, and everybody has to do their job well in order for someone to get taken care of.
It becomes frustrating. You know you can't save them all, but still, you want to.
Doctor, I'll check you out, all right? Okay, just relax.
It can be very hard to be here and see these things on a daily basis. And at the end of the day, you have to have your own method of coping. Some of us can do it, and some of us don't do it so well.
People get burned out all the time, and my goal is to not get burned out.
Any wiggle your toes at all?
No movement.
It's difficult, I think, for everybody. It can tear you up. It really can.
It's almost like you wall yourself off emotionally from a lot of it. His face is obliterated. It's gone. The fact is, I got another case in 10 minutes.
Show me this blood. Okay, that's real. A little concerning when the patient has blood coming out of his penis.
By air, we're going to get there in 10 minutes as opposed to an hour by ground.
Then get ready for an ER thoracotomy. Get over on the left side.
The Memorial Hermann is a level 1 trauma center, and we're one of the busiest trauma centers in the country.
We admit 600 to 700 patients a month.
The chance to be with patients on their worst day is just a nice thing to be a part of. Yeah, I brought oatmeal.
You putting oatmeal in?
Banana.
Oh, kale.
You didn't bring it?
Oh.
That was the best ingredient. My name is Rudy Cabrera. I am a flight nurse. I've been with Lifeline for almost 7 years now. My ritual with Kyle is we like to make smoothies. Getting potato chips. These drinks can be hard to swallow, but he says it's good for me, so I'm willing to try it.
Well, what number would you suggest I go up to?
I'd start low, and then kind of dial it up, because you can adjust the speed here.
I start at like 1.
You gotta have some sort of decompression that'll not make you dwell on maybe a call you had that was severe. It was good, huh? Give Dan some.
Rudy is an amazing nurse. He's currently our clinical educator. I can't emphasize how much Rudy brings to Lifeline, the benefits and his knowledge, and Rudy is the go-to guy.
Lifeline 2, we got an emergency call for an elderly woman with possible paralysis. This is Lifeline 2, be there in approximately 5 minutes.
We got a call for a fall victim. Really could be anything. Right now we're just trying to meet our time criteria to be as quick as possible on scene. We'll get a little more information in just a minute.
I'm Art Tyson. I'm a general surgeon, and it's 7 o'clock in the morning. Another beautiful Houston day. Today I'm on trauma call, and we're going to see what cases need to be done for the day for our trauma patients and wait for the action. And no 2 days the same, brings variety, and I kind of like that. This gentleman fell 15 feet, has significant injuries because of the speed at which he'll hit the ground. He obviously hit concrete.
Everything clear?
First thing is the head CT, and given the fact that he's not really waking up, I anticipate he's got a head injury that might require acute operation. The next thing I'm going to look for is any evidence on the CT scan of injuries that would cause him to bleed to death, that we would need to take him to the operating room. Poor guy. I don't think he was planning on coming to see us. So this patient has 2 potentially life-threatening injuries. One is the head injury, and one is bleeding in the spleen. We'll go ahead and take him to the operating room first and get the spleen out, because further bleeding will only make his head injury worse. All right. Go get the spleen. Okay, the spleen's out. I'm going to close his abdomen first, because he really doesn't have anything else besides the spleen.
My name is Billy Gill. I'm a trauma surgeon here at Memorial Hermann Hospital. So it's 8 a.m. We're headed to the ICU for normal daily rounds. This is the place in the hospital where people who have the worst injuries are brought. We fully expect that the residents have pretty well got the grasp of things now. The most important thing that I want the residents to learn from me is that you really have to plan ahead for particularly an emergency or a critical situation. If you just do the things that occur to you at the time, you'll never be successful in taking care of that patient.
ICU day 2, He was intubated yesterday, and we have been working on his pain control. Basically, he is on...
Basically?
No.
Not basically.
Not basically.
Yes. Have I ever explained to you why I don't like that word? It bugs me when residents say the CT scan was basically negative. Either it's negative and that word doesn't mean anything, or it's not negative and you're hiding something from it. It's the modern version of like, you know, whatever. Don't do it.
Dr. Gill is an interesting person. He's obviously a role model, but he's somebody that is a little scary, can be a little scary.
I think the residents view me as a hard ass and something of a perfectionist. My goal is to go through the day every day with 0 mistakes. That's really the only standard that's acceptable, because that's the only way that at the end of the day, every patient's going to go home healthy. Yeah, I spent a lot of time chewing on you guys, but this was well done yesterday. Okay, this was a difficult diagnostic decision to make. Kudos. She's doing way better today than she was yesterday. The residents we have are extremely talented. I'm here to make sure that they're going to be fantastic doctors. Oh, sorry.
We just got a report from the medics on scene. It sounds like we have a patient that is possibly paralyzed. They have a back injury. These are time-sensitive cases. If anything else comes up, we'll deal with that in round.
This is left, let you touch it down now.
We're responding to an elderly woman who was lifting a trailer hitch and injured her back.
No feeling.
Okay.
What's your name?
Doris.
Doris, you were unloading a trailer, right?
I was trying to put a trailer under a trailer hitch.
I want you to try and wiggle your toes. Not able to?
Still wiggling.
Okay. Our concern here is that the patient is possibly paralyzed. By transporting her by air, we're going to get there in 10 minutes as opposed to an hour by ground. All right, Rudy, we ready to go? Let's get her there.
No movement.
I'm sure low on because she doesn't have any movement below.
Yeah, I agree. That upgrades her. A 55-year-old female status post-lifting accident. There was no fall, no LOC. She has no movement and limited sensation to her lower extremities. We'd like to upgrade this to a level 1. We'll be offloading at 5, hotel for trauma.
Coming up on Lifeline.
So that?
No sensation.
And later,
Motorcycles versus vans. We hit the back windows down with his face.
helmet.
No helmet.
No helmet. If you're not able to shift gears when the patient situation changes, then you won't be very successful.
We're en route back to the hospital. We have an email that hurt her back while lifting a trailer. She heard a pop. She now has no movement or sensation in her lower extremities. We have upgraded her to a level 1 trauma, and right now we're just making sure that she remains stable throughout transport. No movement.
I'm sure low on because she doesn't have any movement below.
Yeah, I agree. Okay. That upgrades her. So we upgraded her from a level 2 to a level 1. What that's going to do is have a whole team of providers ready at the bedside when we arrive to make sure that she gets the best care as quickly as possible. Control, Lifeline 4, Line Harmon.
Do you feel something sharp or dull? You feel that?
No sensation. It looks like she might have injured her spinal cord, maybe severely. Hopefully it's able to recover. So that makes her a critical patient. She needs to be seen by a neurologist right away, but she is stable, and we were able to get her comfortable, so that was good.
Yes. Can you just get her on?
A 65-year-old female. She felt a pop in her back. She did not fall. She was able to sit down. After that, she lost sensation and motor to her lower extremities.
Can you feel this? How about here?
Oh, this level 1?
Can you feel this?
She's got numerous back.
How about here?
She's got numerous back surgeries. She's
Can you feel
lifting a
this?
lift gate.
Like T7 down.
I gave her 75 of fentanyl, and I gave her 10 of Reglan. She got real nauseous in flight. Yep. And I have her iStat I can give to you, too. She currently doesn't have any movement or sensation below her belly button, but we'll have to follow up and see how she does from here.
I really enjoy cooking. A lot of people, especially the residents at work, don't know this, that I enjoy cooking so much. I don't want to, sound less tough. I'm Michelle McNutt. I'm one of the trauma surgeons at Herman Hospital, and this is my very lucky husband, Billy Gill, also one of the trauma surgeons at Herman.
You know, I got married. This just got assigned to be part of my duties. There wasn't any discussion, any negotiation. The one thing I was certain about when I was dating was that I was not going to marry another surgeon. I didn't know anything else about my future wife. I was not going to marry another surgeon. Last night we had GSW to the hip, pediatric ×2. Don't you
Bad night
see
for
that?
kids.
Not from the same event.
Yeah, I usually know when he's had a rough day. You can tell by the tone of his voice on the phone. When I ask him questions, very short answers, or I'll actually hear beeping and coding going off in the background, and we help each other through it.
So can I help? I usually help by staying out of the way, I know.
No, you can give me a hand.
Yeah? How about I sharpen some knives?
Hell yeah.
We're able to kind of lean on each other a little bit. We both have very healthy respect for each other. Trauma is very, very difficult because people can turn south very, very quickly. And it takes a lot out of you when that happens.
Now, I obviously don't have all of the nice tools that I would have in the operating room, so I make do with my finger. I've always been mortified if I were to stick myself and come up with some awful salmonella infection and lose my finger. It'd be tough to explain. We're both really good about not keeping our emotions and frustration pent up on the inside and then blowing up at the smallest little thing. We're very open, we communicate well, so, we actually haven't even really had a fight. Have we?
Knock on wood. Give me some wood.
Almost done. Oh, now your part comes up. Olive oil.
Olive oil. Where is it?
In the pantry.
Right now we're en route to a scene of a motorcycle crash. What we do know is that the patient was unhelmeted, ejected, and our main concern right now is going to be possible head injury.
This guy, he's got a lot of trauma to the face. He's missing teeth. He's got blood coming out both his ears. So if he's got any kind of brain injury or any type of internal bleed up top, they got to rock and roll.
They're probably on the road, buddy. We got your wallet and stuff with us. We'll give it to the nurse, okay? The doctors are gonna all check you out, all right? Okay. Just relax. All right, status post motorcycles versus vans. Estimated 30 to 40 miles per hour. He hit the back window of the van with his face. He had multiple lacerations in his face, more swelling on the right versus the left.
Helmet?
No helmet.
No helmet. Primary. Show me this blood. Okay, that's real. This is probably not from a pelvic fracture because the pelvis looks normal. This is probably a direct injury. A little concerning when the patient has blood coming out of his penis. That is never a good thing. Coming up on Life Flight, we're going to need to do a little bit of workup to see how bad that injury is. And later,
This kid accidentally shoots himself in the face. Trauma like this shouldn't happen. His face is obliterated.
this gentleman was in a high-speed motorcycle crash. He's got blood coming out of his penis, actually, which is indicative of certainly that he might have an injury to his urethra. You can give him 100 of fentanyl, please. That's an injury that has a lot of lifestyle issues associated with it. Is his clavicle broken?
No, it's not.
It's not. All right, can we go to CT? Get him ready to go. The situation can change quite dramatically from minute to minute, and if you're not able to shift gears when the patient's situation changes, then you won't be very successful. Sure did.
Let's worry about you first, okay?
I don't see a whole lot here. Is exactly what we thought would happen. So, it does look like the primary injury is actually the penile injury plus the facial laceration, so we're going to need to do a little bit of workup to see how bad that injury is. Luckily for him, at least, it doesn't look like there are any life-threatening injuries, so I'm predicting he's going to have nothing internally. We'll put a catheter in the penis so that we can drain the blood out of there and drain the urine without the injury closing off the penile urethra. But oftentimes, particularly if it's completely transected, it will need reconstruction. So now that we've ruled out internal injuries, we'll be sending him off to surgery to deal with his injured penis. He'll be in good hands, but I'm pretty sure he's going to go home a little bit worse for wear.
What we have is a young person who accidentally shot himself in the face while he was cleaning his rifle. What we're trying to do is keep his airway clear with suction until we can get to the emergency room. 541654. We have an 18-year-old male status, post-gunshot wound to the face, bleeding heavily. He is currently a GCS of 3. If we could have airway management at the bedside, there's a lot of blood coming from the mouth.
Handgun or AR-15, 223. Looking at an 18-year-old who just severely altered his life by playing around with a semi-automatic weapon he just bought. And I don't think he's going to have a head injury. We'll see. But he's going to have his face is never going to be the same.
Yeah, he wasn't self-inflicted. It was playing around.
This kid bought this rifle at the convention yesterday and accidentally shoots himself in the face. You know.
Let's get a oral gastric tube. I think it's
It's almost like you wall yourself off emotionally from a lot of it. You just kind of get used to it, I guess. But the fact is, I got another case in 10 minutes.
Well, honestly, what I would do is let's rewrap him.
Yeah.
Once we get it.
It looks real anterior, like his soft palate's intact. His anterior teeth are bad. His anterior maxilla is bad up to his nasal cavity.
From what they're describing, I mean, he was talking, he was choking on his own blood, obviously, but he was talking basically GCS of 15 on the scene. We'll adjust his ET tube just to make sure it's secured in the ideal place. Place an oral gastric tube, which goes in the stomach, because he swallowed a lot of blood, and we don't want him to aspirate that. We'll do scans of his head, so his brain, looking at his face, and also the vessels in his neck, as well as his C-spine, so you can obviously get a lot of torque.
Calling whoever's on call for face, and they'll come evaluate him. The first thing they'll do is make sure that he's not actively bleeding. Then they'll have to plan his reconstruction. It'll take multiple operations. Problem is he doesn't have much native tissue native bone at least to reconstruct.
You can see here, it kind of came in here and just annihilated all this bone.
His face is obliterated.
It's gone.
Every time I see this, I think, well, how the hell is this happening?
It doesn't look like he's got a severe brain injury from what we see.
All these little white, that's all just shattered bone. His eyes being here.
It's just angry. It's just anger. Stuff like that shouldn't happen.
Not impressed.
Hey.
Hello. Come on. People get burned out all the time, and my goal is to not get burned out.
We'll have daddy duty as we have a baby on the way.
Yes. That's so much time training, I want to obviously continue going for a long time, and there's only so much energy that I've got. Come on, y'all ready for a treat? All right, sit down. That's it. They don't do anything that we say.
Off to Liberty County. Don't know what it is yet until we get in the helicopter. They'll probably tell us.
We're in flight right now to a motorcycle crash. By ground, it's about 45 minutes. By air, it's about 5 minutes. We don't know the extent of the injuries, but we'll find out when we get there.
They hit the motorcycle accident. Just complaining of pain to his right leg, looks like his right femur. Just started complaining of pain to his left leg.
How far away was he from his bike?
Oh, probably about 20 feet.
I still do feel my heart come up to my throat. There's still fear, still fear of failure. And I think it wears on a crew member because you're putting that patient's life in your hands. It's a lot of responsibility.
Thanks, guys.
All right, take care.
Let's come in.
Code 3-5.
Here we go.
Control Lifeline 2, we're inbound with a motorcycle crash victim, currently at level 2.
What's hurting you? Chest? You got pain in your chest?
The patient is complaining of pain in the chest, so we should go ahead and do an ultrasound of his chest to identify any injuries. Oh, look at that. I don't know about that right there. Dude, I almost want to say that's positive. I see what they're talking about, yeah. This is a bit more serious. This patient has possibly blood in his abdominal cavity. We'll upgrade him to a level 1. Yeah. Control Lifeline 2, we're going to go ahead and upgrade this patient to a level 1, finding a positive pass of fluid in his abdominal cavity. That way we can have the trauma team available when we get there.
So the pager just went off saying we have a level 1 coming. Everybody's notified that someone very critically ill is coming in. Coming up on Lifeline.
What we're worried about is what's going on in your back. You're broken a bunch of bones.
Oh, my. And later, this is a hard job that really requires some kinds of emotional defenses to deal with on a daily basis.
We're in flight to Harvard Hospital with a motorcycle crash victim. We've upgraded the status to a level 1 from a level 2, making it more critical. We identified blood in his abdominal cavity at this time, so he has some sort of injury, possibly to his liver, spleen, or some big vessel in his abdominal cavity or pelvis.
You're at the hospital already, okay?
How was this upgraded? Are they giving him blood products?
We can't adjust, okay? The board's rigid.
I'm Dr. McCarthy. I'm the Chief of Emergency Services here at Memorial Hermann. So pager indicates that this was upgraded to a level 1 because of the positive fast. What that means is that the flight team, paramedics or nurse, used ultrasound to determine that there is free fluid and likely, in this case, blood in the patient's abdomen, meaning it most likely require an emergent operation.
All right, everybody ready? 60-year-old male was the driver of a motorcycle, complaining of pain to his right leg and to his chest. He did have a positive pass on the right side.
Clear. Is there any way you can raise me up in the back part?
We can't raise you up just yet, sir. What we're worried about is what's going on in your back, so we're going to go to CAT scan, okay? You broke a bunch of bones. Multiple extremity fractures. Left arm's broken, deep soft tissue into the left wrist, which is why his hand's not working very well. The tendons and nerves are cut to the hand, so we'll explore that a little more carefully. Both legs are broken, both femurs, so we're checking the pulses in his legs now. There was a concern about him having a pre-hospital positive fast, which means that he's got blood in his abdomen. What we're seeing now, we think they were faked out by something. It looks okay to us here.
So it looks like this patient didn't have any blood in the abdomen. He's got several broken bones. Recovery is going to take some time, but looks like he's going to do well. He'll recover from this.
In the emergency department, there's really very rarely downtime. He's lucky. We do get occasional lulls where things slow down a little bit, and that's an opportunity to go back and kind of look over everything you've done, make sure you're not leaving a detail out.
But these are very comfortable. The main advantage of these over these don't get slimed. Now and then when things get exciting, that I don't get blood on my socks.
See, but I can throw these in the washing machine.
Right, but I can hose these off with the hose and we're all done.
We do serious stuff and see pretty horrible things, so when you can find a moment to crack a smile or be friendly with someone for another reason, of course.
The main advantage of these over those
is if you get bit by a snake
no.
in the emergency department, gets loose, that someone brings in,
but
that his steel toes will actually protect them.
So this is probably the only part of the hospital that does have live snakes periodically.
That's why I said that. We had 2 the other day.
Burn patient, where to?
Sorry about that.
Thank you so much. You guys may want to have some more Dilaudid or whatever your opioid of choice is handy.
1, 2, 3. Got electrocuted from some power lines. He has 2nd and 3rd degree burns to the face, head, arms, chest, and back.
All right, primary airway is intact. 802-24 at the teeth. Breath sounds are equal bilaterally.
So as you can see, we brought in a burn patient. It was electrical burn. Sometimes with a burn patient, you're actually the last person that they ever see or talk to because they don't survive for very long after that.
Whenever a burn patient comes in, we need to make sure that his pain and sedation is adequate, and we also need to assess what all his injuries are as far as the extent of his burn. So we have to take all these dressings off because we got to look at it.
Dr. Tyson.
Yes, ma'am. To work in trauma, you have to be able to work with people. You have to be able to work in teams. You have to be able to make quick decisions. And you have to have the will to act quickly and definitively.
We ready to go?
Yep.
Ran into Dr. McCarthy down there. He updated me on Doris, the lady with the back injury.
Right.
And he said that she is about the same, but they're going to do some more tests.
She's doing better, huh?
Yeah, she
Lower
is.
and lower extremities. So that's a good thing.
Hotline 4, planning at Herman in 5 minutes.
So we picked up a kiddo that was shot in the pelvis. Throughout our exam, we've been unable to find an exit wound, any type of penetrating trauma to the abdomen. It's a world of trouble.
Everybody ready?
Yep, we're ready. Secure right, secure right.
Everything's okay.
All right.
Everything's all right.
It's getting covered up a little. Do we know where this GSW is on the patient?
In the pelvis.
This could be quite bad.
We've got a young child that's taken a GSW gunshot wound to the pelvis, and we've got him in the best hands that he could possibly be in right now. I wish we could stay and kind of see what the outcome is on these patients, but we can't. We've got another flight, so we've got to get moving and get ready for the next one.
X-ray pelvis, watch your hands. What do you want to do?
I do a triple contrast CT, so
All right, make it happen. Sometimes we do things that work out really well, and it's easy to take credit for that. But there's a flip side to this job that's very difficult because not everybody survives. This is just an X-ray machine, okay? It's just going to take pictures of you. I know you look worried about it. What we have going on is that the bullet on X-ray is up on the middle of the back, and so unfortunately for this kid, the trajectory is concerning for an injury to his colon. If there were gonna be an injury, yeah, it would be right there. Coming up on Life Flight.
Hey, Doris. How are you? Are you able to move your legs at all yet?
And later, this is a hard job. All of medicine is a hard job. But it's a lot easier to do it if you're enjoying what you're doing. This is just an X-ray machine, okay? It's just going to take pictures of you. I know you look worried about it. We're scanning this 5-year-old boy who was involved in an accidental shooting. What we have going on is the bullet on X-ray is up on the middle of the back, and so unfortunately for this kid, the trajectory is concerning for an injury to his colon. Yeah, this is X-ray anatomic, so there's the entry, and it just kind of goes through this. If there were gonna be an injury, yeah, it would be right there. It's retroperitoneal error. The big concern here is that the bullet traversed his pelvis and injured his colon. Yeah, so it looks like the bullet missed all the vital organs. There is one spot where it came very, very close to the large intestine, and so we'll bring him in and keep a close eye on him. No need for surgery, which is always a good thing. I think he's going to wind up being okay. We get to tell his mom he's going to be okay, which is nice.
Morning.
Jamie, what's going on, man?
how are you?
We had one gunshot wound come in, but he did okay. I'm just kind of checking the book and seeing where he went. But otherwise it was typical Sunday night.
Sunday night volume not too bad.
No, not that bad. How are you?
Good. You know, see what Monday's like, dusting off and what kind of mess has all been made on the weekend.
Yeah, you gotta come and clean up after people like me.
Right, of course. Part of what I do is to check in on how all the staff are doing, whether it's emergency physicians who report directly to me or nursing colleagues, just to make sure the system as a whole is still working well together. Everything going home? Wife doing well?
Yeah, she's good. She's got pretty good energy. She's at about 30 weeks now.
Events after that get very, very exciting, but you'll have fun.
It's my first time, so
You'll get a new understanding of the word tired.
great. I think my goal in life is to see if I could, master that word.
Yeah.
It's a big hospital. It's a small community. We all know each other.
I think my role is important because that's what I'm focused on, but it's no more important than anyone else's role. And you got to keep yourself in perspective. You're part of a process. You're part of a big group. Patients come here for trauma. We're a good trauma center, not because of me as an individual. It's because of the team we have, the team I'm part of.
I do like to follow up on patients. You need that comfort. You need that hope. You need to feel like they're going to be okay.
Hey, Doris. How are you? You remember me?
Walking in and looking at Doris's face light up, smiling at us, makes us feel good, makes you feel it in your heart, and letting you know you made a difference for her.
Joe was so sweet. I appreciate y'all.
Are you able to move your legs at all yet?
A little.
A little bit?
Yes. I'm wiggling my toes.
Okay.
I know that that's not a whole bunch to get excited about, but hey, every little bit helps.
Yeah, and you have the right attitude. When you go around on patients, you can see them improve dramatically. It can be emotional. We knew you were down here, and we were down here. Just wanted to say hello.
Oh, y'all have been just super fantastic. Y'all have made me comfortable. You've made me feel secure. And when I was scared, you held my hand and let me cry.
Well, thank you. We appreciate that.
Story? Single GSW to the right temple. He's pretty much been unresponsive.
No sedation, no medications given. GCS3 abstain.
What we're looking at here is almost certainly self-inflicted gunshot wound to the head. Bullet on the x-ray is crossed from one side to the other, which is never a good thing. That is a classic contact GSW. You can see that there's a bunch of powder burning right around it. A small hole right up on the side of the temple there.
So what Dr. Gill and the trauma team have found is that there's powder residue on the side of the patient's head. The residue is also on his hands. It tells us that it was self-inflicted as well.
GCS3 at the scene, gasping respirations.
What was his initial heart rate?
In the 40s.
In the 40s, so it's been 40s and...
It's been like 42 now. It's gradually starting to drop down.
Just at first glance does not appear to be a survivable head injury. We'll go to the CAT scanner and make sure. You just got the one GSW?
Yeah, just a little.
All right, make sure.
Count of 3. 1, 2, 3.
22.
22.
Yep, sure is. Is that what they said?
Yeah, they said 22 long.
They were right. That's a 22 hollow point.
When we arrive on scenes like this, it's frustrating. You know you can't save them all, but still, you want to.
Al, you see if the scanner's ready for us? Thank you.
This is a hard job. All of medicine is a hard job. But it's a lot easier to do it if you're enjoying what you're doing.
Wow. I'm not even sure if that's real. Coming up on Life Flight. See that?
That's the fragments.
We have a young man who shot himself in the head. Right now it does not look good, but hoping to find something on the scan that'll allow us to have a little more hope than what I see immediately here in the ER. Wow. I'm not even sure if that's real. Did that bounce off the inside of his skull? All right, look here. Straight through there.
I see that there.
See that?
That's the fragments.
And here's your tract, and it bounces off right there and winds up down low. It'd be a fatal gunshot wound.
Is that it?
Yeah, at this point, probably the best thing that we can do is preserve his organs as much as possible for maybe being a potential organ donor, because there isn't going to be a whole lot of other good that comes out of this case. Sometimes not going to be able to do anything for the patient, but maybe the family can get something positive out of what is going to be a very, very negative situation.
It is frustrating, you know, but you still got to go in with the mentality every time that you're going to get them back, you know, knowing in the back of your mind that you can't save them all.
Hey, how's it going?
Seeing Michelle at the end of the day makes me know everything is going to be okay. Does that sound corny? I appreciate you telling me about this 10 minutes to 5 so I'm able to dump it on my wife. I want every patient to go home healthy, and obviously that doesn't happen every time. I know we as a team do a very good job, but every time things don't work out, it's an opportunity to figure out what we can do better. All right, bud. So, I was going to tell you that there's really nothing going on. There's no outstanding cases and no outstanding transfers. However, having somebody at home on the bad days really helps a lot, especially somebody like my wife, who's somebody who truly understands everything that I'm going through. We don't like to take work home, but it's inevitable, and we really do support each other on the bad days. Did they finish the dining room?
Yeah.
They did?
Awesome.
Is it?
Yeah.
And Chico? Do I need to feed Chico?
Yes.
I need to feed Chico. Okay.
He got a little bitty snack, but he's anxiously awaiting dinner.
There's a lot of bad stuff that happens in trauma. I mean, awful, terrible stuff that really requires some kinds of emotional defenses to deal with. Otherwise, it can be very hard to be here and see these things on a daily basis.
See you.
All right.
Love you.
Love you too.
Hello. Ladies, what's going on? What? Oh, let's go. One time I was walking out here and at a stop sign, these guys were in this convertible. They kind of looked at me with the dogs and snickered and said, "Nice dogs." And I was just thinking to myself when they were doing that, you know, this is what your ultimate goal is. This is what you're going out to do. Find a girl so you can take care of her dogs.
It's a good turnout today. We have a couple special guests. We have Tom Flanagan, COO.
I don't know how many of you get the Houston Chronicle, but this past Sunday, the whole section for Nurses Week, the top 100 nurses in the Houston metropolitan area. And this year, Memorial Hermann Lifeline is proud to recognize that Rudy Cabrera was selected and is being presented this award from the Houston Chronicle. Rudy, congratulations.
I guess the biggest thing I can say, it's a team effort, right? We've really advanced as a team. I see you guys come in. I know y'all work hard. It makes me real happy when y'all deliver real good patient care, doing everything possible, even more than 100%. It just really, really makes me happy. I know I don't say much. I'm pretty quiet. But I'm really proud of all of you guys.
Next time on Lifeline.
There's a lot that we see and deal with every day, a lot of death, a lot of serious injuries.
Leave work where it belongs, at work.
Seeing all the things that I see during the day, it's easy to come home and be thankful for the things that you do have.
That sometimes